Today, we're going to talk about why therapists should avoid asking their clients the question, how does this make you feel? There's a couple of different reasons for this. One, this question can come off as really ingenuine or inauthentic. It's a really stereotypical therapy type question that you might see in the movies or on TV. However, we as real therapists should really avoid asking this question because it does come off as ingenuine at times. Another reason is because clients sometimes don't know how they feel. So when we ask that question, how does this make you feel? And they don't know the answer to that question, it can really shut down the client. Instead, what we should do is ask really insightful, open ended questions, use reflective statements, and use a variety of counseling skills to help our clients explore how they're feeling and process how they're feeling, and eventually be able to identify how they're feeling. So we might use the skill of immediacy and say something like, I noticed as we started to talk about your mom, you started to lean back in your chair, and I could see a change in facial expression. You went from smiling to kind of scowling, and it looked like you were in distress. Do you want to talk about that? That's an example of a way to take something that's going on within the session and be able to reflect that observation back to our client and to be able to elicit some type of processing or response from the client. We also might use skills like paraphrasing, reflection of feeling, to elicit some deeper reflection from the client to help them identify what emotions are at the root of their experience. So thanks for joining me today to talk about one of the questions that we should avoid in therapy, which is asking a client, how does this make you feel? I'll see you next time on Therapist Things with Dr. King.